Spanish flu, 1918 Influenza Pandemic, stands as one of the deadliest pandemics in recorded history, with a death toll estimated between 50 to 100 million people worldwide. This catastrophic event emerged during the final stages of World War I, exacerbating the global turmoil. This script explores the origins, spread, symptoms, societal impacts, and eventual decline of the Spanish flu, illustrating how this virus reshaped the world. Scene 1: Origins and Early Spread. The Spanish flu, despite its name, did not originate in Spain. The first known cases appeared in the spring of 1918 in a military camp in Kansas, USA. This H1N1 influenza A virus spread rapidly among troops, who were mobilizing for World War I. Crowded conditions in military camps and trenches provided the perfect environment for the virus to thrive. As troops were deployed to Europe, the virus traveled with them. By May 1918, the flu had spread to France, Germany, and the United Kingdom. The war's constant movement of soldiers and refugees facilitated the rapid dissemination of the virus across continents. Unlike previous flu strains, this virus struck down the young and healthy with unprecedented ferocity. By the fall of 1918, the virus had mutated into a more virulent strain. The second wave of the Spanish flu hit with devastating force, causing a significant spike in mortality rates. Cities worldwide, from Boston to Bombay, became epicenters of the pandemic, with hospitals overwhelmed and public services stretched to their limits. Scene 2: Symptoms and Progression. The Spanish flu presented with typical flu-like symptoms: fever, chills, and body aches. However, it quickly progressed to severe respiratory distress. Patients developed a distinctive heliotrope cyanosis, where their skin turned blue from lack of oxygen. Many succumbed to secondary bacterial infections like pneumonia. Unlike other flu pandemics, the Spanish flu predominantly affected young adults between 20 and 40 years old. This unusual mortality pattern was due to a cytokine storm, where the body's immune system overreacted, causing severe lung damage. The stronger the immune system, the more devastating the response. The rapid progression of symptoms left little time for medical intervention. The lack of effective treatments or vaccines meant that care was primarily palliative. Hospitals and makeshift clinics sprang up in schools, churches, and other public buildings to cope with the overwhelming number of patients. Scene 3: Societal Impact. The Spanish flu had a profound societal impact. Public gatherings were banned, schools and theaters closed, and public transportation limited. These measures, although necessary, led to widespread fear and isolation. Many communities instituted quarantine zones, and mask wearing became mandatory in public places. The healthcare system was pushed to the brink. Doctors and nurses, already depleted by the war effort, were overwhelmed by the sheer number of patients. Many healthcare workers fell ill and died, further straining the system. Communities relied heavily on volunteers and makeshift hospitals to care for the sick. The pandemic also had significant economic impacts. With so many workers ill or dying, industries struggled to maintain production. Public services, including transportation and sanitation, were disrupted. The fear of contagion led to labor shortages and decreased productivity, exacerbating the economic difficulties of the post-war period. Scene 4: Economic and Cultural Consequences. The economic impact of the Spanish flu was devastating. The loss of life and the resulting labor shortages caused significant disruptions in various industries, from agriculture to manufacturing. Many businesses failed, and the economic strain contributed to the post-war recession. Culturally, the pandemic left an indelible mark. Art and literature of the period reflect the widespread grief and loss. The global trauma influenced works like T.S. Eliot's The Waste Land and the paintings of Iga and Sheila. Society's collective psyche was scarred, with the pandemic becoming a somber backdrop to the Roaring Twenties. Despite the challenges, the pandemic spurred advancements in public health and medicine. Governments around the world recognized the need for better disease surveillance and response systems. The establishment of national health organizations and improvements in medical infrastructure were direct results of the lessons learned from the Spanish flu. Scene 5: Decline and Legacy.